And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Good morning, it's Tom Lucas. Let me just change my hat here quickly from being Mr. Real Estate to Mr. Dentistry just a minute now, because when I talked about real estate, I have to smile pretty, and in order to smile pretty, I have to have some good-looking teeth, and in order to have some good-looking teeth, I need to go to BC Perio Dental Health and Implant Center, and I believe I'm, through the magic of radio, I'm there now, and who's standing in front of me? None other than Dr. Ronald Zokol. Good morning.
And good morning to you, Tom.
Nice to see you.
Thank you. Nice to be here.
Nice to be here. It's springtime.
Boy, that weather is gorgeous.
Almost summer. So when summer comes, people will be doing things like backyard barbecues, there'll be family get-togethers, there'll be people staying over for the weekend, people visiting. So people have to look good because people like to smile and laugh in the summertime.
They do indeed.
But there are some people who, well, you've probably seen them in your office. There's a family picture or whatever, and they're in the background with their hand over their face.
Or some people pulling a very tight smile where they don't allow their lip to come up.
So what do you do for somebody like that? They come and see you.
Those people are hard to manage sometimes because they spend a lot of time learning how to smile differently so they don't show their off-colored or compromised teeth. And even when you rebuild them, they've actually got to retrain themselves to smile big and wide and get that lip up so people can see the beautiful teeth.
So if somebody comes to see you and they're not smiling within a short time, you will have them smiling.
We'll have them smiling.
Let's just talk about you and Dr. Bobby Birdie for a short time, in case somebody is just listening to our show for the very first time this morning and they go, I know that name Zokol from somewhere. I think he used to be over on Canby Street. You're the same gentleman, right?
That's me.
Okay, so now you've moved from Canby to West Broadway.
That's correct.
You got in touch and you got together with Dr. Bobby Birdie. Tell me how all that came about.
Well, that's an interesting one. Now, the difference is only 4 blocks, I might add. So I was 12th in Canby. He's Willow, a 700-block Willow at 777 with Broadway. What had happened is that Dr. Birdie graduated from Minnesota in his graduation programs in prosthodontics and periodontics and came to live in Vancouver and sought me out. We chatted, and he decided that it would be a good idea if we worked together. And since I'm a few years older and such, I thought that this would be an excellent idea. So he picked up my practice, and I went over to his area of the world, 4 blocks away at 777 West Broadway. And now we've been working together for about 9 months. It's looking good.
You've been doing this now for quite some time, though, right?
Oh, yeah.
On your own.
Oh, yes.
Your dad was a dentist?
He was. I practiced with my father for 20 years before he retired. And when he did, I was on my own for the next 20 years, and now I'm in my first year with Dr. Birdie.
I've never asked you this question before, Dr. Zokol, but I'm going to ask you now. When you were just a young guy growing up and your dad's a dentist, what made you decide you wanted to get into dentistry? Why would you want to put your fingers into somebody's mouth?
Well, I can recall asking a similar question to a proctologist.
Okay.
He says, well, your area of interest is dirtier than my area of interest.
I see, okay. Just let that one go, Ron. Come on now.
But dentistry is an incredibly, I'd say, rewarding profession. It is more intricate than one would imagine. And because so much of people's lives are focused with what they see in the mouth and how it functions and how they gain their nutrition, is proper function and remaining stability over decades and decades of time, learning how to do that really well is a fine art. And it's a process by which you grow through all the years of your experience. If you don't, you become very average.
Right.
So it's an incredibly rewarding thing. You make a good living doing this, for at least most people who are dentists do. But the other thing that you can't put a monetary value in is what the patients feel like, and changing somebody's life, and literally changing their life is such a great turn on. It's wonderful.
Well, I know, and I know that you're sincere because I've been to your office a few times now. I'm sitting there, of course, drinking your free coffee and looking at the view. But other than that, when people leave, they go up to the receptionist there, and they're just ranting and raving about you and Dr. Bobby Birdie.
That's good.
They
I'm
love
glad to
you.
hear that.
Well, no, because you do great work.
Well, I'm glad people believe that. And when they come out of there and they take a look at, they can see in the mirror, it's when it lasts as long as it does without problems. That's when you know you've really done a great job.
Not only do you take care of British Columbia, and worldwide, you have people coming from all over the world actually to see you, don't you?
That's true.
Yeah. But not only do you take care of people from all over the world, you also teach other dentists what to do and what not to do.
Been doing that for 35 years.
Wow.
Yeah, teaching other dentists. You learn what you know, and if you learn to do it at a very advanced level, dentists come to you and they hire you to teach them, and that's really rewarding in and of itself, because you're not just serving patients and treating individuals, you're teaching other dentists to become significantly better themselves, and they can pass that on to all their patients.
Now, before the show, you and I and a couple of other guys were talking about your office, about BC Perio, and you were saying that you are now working with Dr. Bobby Birdie, but you both sort of like learn from each other as you go along each day.
Oh, absolutely. The collaboration is absolutely spectacular. I enjoy it. There are days during the week when Dr. Birdie is in a different clinic, and so am I. And but when we come together and spend time together in the same room, we collaborate on cases and pass them back and forth. And the information from a different perspective is always valuable. And I really enjoy our collaborations. Very good.
Let me give your address in case people are listening again for the very first time. It's BC Perio Dental Health and Implant Center. The location in Vancouver is number 501-777 West Broadway. That's at
Willow and Broadway.
Willow and Broadway in Vancouver. The telephone number there is 604-259. No, it's not.
Yeah, it's 604-872-0222.
Okay, so I'll give the number. Do you want to pick up the edit there, Dwayne? Okay. The address is 501-777 West Broadway. That's 501-777 West Broadway. The telephone number is 604-872-0222. That's 604-872-0222. If you're out in the Tri-Cities area in Coquitlam, it's on Johnston Street. The address is 1175, unit number 250. And the telephone number in the Tri-Cities area is 604-936-8244. 604-936-8244. You can make an appointment. Now, on the show for the the last several months, we've been talking about your free consultations. Are they still available?
They are.
Tell
Absolutely.
me. I know you've got my attention.
Well,
tell me about it.
See, the philosophy is this, and I have to compliment Dr. Birdie on this philosophy. If we can have as much possible information as we can get without costing an awful lot of money, people will have an opportunity to understand at as much detail as possible what's going to be required to help them achieve the goals that they're looking for. So the x-rays we take are normally $375 each, and we're saying let's put that aside. Okay? And what we'll do is that we'll work with our patients that come in, and they're coming in strictly on a prospective basis because they don't know whether or not they should do it or what's going to be necessary until they find out what it's going to be and how much it's going to cost. So we try to take out all the roadblocks to understanding at least what the best route of treatment is. And when we do it, then it's completely up to them. There's no commitment. They don't have to do it. They don't have to pay it back. There's no way. It is just an avenue for us to find out as much as we can about our patient.
At the end of the consultation, you are able to tell people what they'll need to have done and exactly what it's going to cost.
Yeah, for about 98% of people. And every now and then one comes in and they're so severely damaged, and some are recoverable, some are not. And sometimes you have to do more thorough analysis or talk to their physician or talk to another specialist to find out where we're going to go. But by and large, the average person will find out pretty specifically what would be in their best interest that day.
You would also tell people what is not having to be done?
Oh, for sure.
Yeah.
Yeah.
And I know that from fact. My wife went to see you guys, and she thought she had to have a tooth out, and Dr. Bobby Birdie said, Well,
I remember a dentist came to see me who felt he had to have a tooth removed, and I said, what's it worth to you if I can save it? And he says, I got this bottle of very, very fine wine.
Well, now, okay.
And I said, okay. I saved it for him.
So there are
and he was
benefits to this,
incredibly
huh?
grateful. The point is that it's not about implants. It's really, implants are just a single avenue to a solution. A very good solution, I might add. But if you can save the tooth, that's immensely better than putting an implant in its place.
And you will do that sort of thing?
As much as we can.
See, that's what I like about you guys down there at BC Perio. If you can save the tooth, you will save it and not have to put an implant in, right?
Of course. It's about the patient. It's what's in your best interest. And if everything that we can think of or that you would like, you come in and say, could you take this tooth out, put implants here, I want this. And I look at it and it makes no sense to me. I'm going to tell you it makes no sense to me.
Mm-hmm.
I'd rather, and if the work you're looking for is going to be expensive, and it's not going to last very long, I'm going to tell you that. It's going to be a bad investment. I'd rather you hold on to it and go a different route somewhere in the future than to take your money today and throw it away.
Makes a lot of sense to me. Well, I tell you what, we've got one of those nifty tooth songs coming up for you. I know you just come here on Saturday mornings because you love these tunes. So we're going to get one of those on for you in just a second. It's Tom Lucas. It's Boomer Life, and we're talking with Dr. Ron Zokol of BC Perio. It's BC Perio Dental Health and Implant Center. 2 locations for you, 501-777 West Broadway. That's 501-777 West Broadway in Vancouver at Willow Street. If you'd like to call for your free consultation, and I repeat, it's a free consultation, folks, worth big bucks, 604-872-0222, 604-872-0222. And in Coquitlam, it's number 250, 1175 Johnson Street. That's number 250, 1175 Johnson Street in Coquitlam. The telephone number at that clinic, 604-936-8244, 604-936-8244. We're coming back with more from Dr. Ron Zokol in just a minute.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.